As part of the Paths to Prevention series with Allianz, I'm meeting with Dr. Uli Zucker to talk about lung health.
Dr. Uli, over 1 billion people globally are affected by lung disease. And smoking is obviously the highest risk factor, but it's not the whole story, is it?
Yeah, well, smoking is by far the highest risk factor. Asthma, frequent infections, but also air pollution,
So many people live in cities, and so many cities do not meet the safety requirements for safe air.
There are cities where people spend most of their life indoors, exercise indoors, have air purifiers.
Because it's so bad outside.
Yeah, and that especially is important for people with asthma and other chronic diseases. COVID was really a game changer in terms of informing people about their lungs. COVID-affected people are still suffering from consequences of it, up to scarred lungs, fatigue, and other symptoms.
Yeah, they're still suffering now. And so we know that smoking is the number one risk factor, but a lot of people have switched to vaping.
We don't know enough yet about vaping and the consequences, the long-term consequences it can have on your lungs.
And then secondhand smoke is also a big issue, particularly for children.
Absolutely. You sometimes overlook that, but when children are in the car with you or in a room with you, you should definitely not smoke.
And what kinds of things can we do to improve our lung health?
Well, the number one, as I already said, stop smoking. After that, exercise.
Right.
Exercise is excellent for the lungs because you need more air and you expand them completely.
The elasticity grows and all that.
Exactly.
Yeah, okay.
And one thing that is actually nice is you can start singing, or if you're already singing.
Yes, I remember doing vocal lessons, and it's all about the diaphragm and getting as much air into your lungs as possible.
Exactly. And talking about music, learning or playing a wind instrument has the same effect.
And then I heard laughter is a good one for your lungs as well.
Yeah, of course. And laughter has the added benefit of making you happy.
Yes,
and
releasing all those lovely chemicals in your brain.
Exactly.
Okay, so then vaccines. What about vaccines nowadays? Should we still be looking at those for our lung health?
Yes, definitely. The COVID-19 vaccine, I think everybody knows about it.
Yeah.
It's still something you should get, every new version that comes out of it, because it's adapted to the different mutations, but also the flu vaccine and the pneumonia vaccine, especially this one for older people.
Yeah.
And for people with chronic diseases. It can really save lives.
I don't think I've ever valued a breath as much as I do right now, to be honest.
The lungs give us life.
Yeah. Our lungs really are very, very important.
Yeah, precious.